Hey guys, it's me. So before I get into this Q&A, I'm going to let you guys know that everybody is different. Every surgeon is going to be a little bit different in how they do their process, how the healing process works for them, and everybody else's bodies are different. How you heal is how you heal. This is just my experience. I had a bunch of questions, and a lot of very common questions that the hip dysplasia world gets, and I kind of collaborated those together for this Q&A. These are just the answers that I have from my personal experiences with the PAO surgery and my story with hip dysplasia. So let's begin with the Q&A and see where it goes. Okay, so the first question I have found out from a lot of people that I have talked to that have had the same type of journey I have was, the first question we always get is, what is hip dysplasia? So, to answer this question, I actually found my old preservation booklet that I'm actually going to kind of reference to when I do this, and I'll show you photos as well. Hip dysplasia is actually when the socket that goes around the ball joint of your hip is too shallow for the ball joint to be in, and it actually kind of looks like this. I'll show you the first picture right here. And sometimes if you get the socket gets too shallow, you can actually have a dislocation. Your joint might slip a little bit. It feels very weak. It's painful when you walk with it. When you sit down, it can just hurt in general. So hip dysplasia is when the socket is actually very, very shallow. And that is basically, I don't even know how else to explain it, but it's when the socket is very, very shallow when it comes to hip dysplasia. It's just very painful all around, and it can cause a lot of issues in the long run, especially if you're like lifting heavy objects or trying to lift in general. Your joint might feel very, very weak when you lift. Alright, the second thing is actually not necessarily a question, but more than a statement. A lot of us in the hip dysplasia world have heard this quite often, and it is, I thought that only dogs get hip dysplasia, and that is absolutely not the case. You can have hip dysplasia as a child. In my personal journey, I actually had a dislocated hip that was not discovered until I was 6 months old. And that has caused me a lot of the problems that I have today. And that is not by my parents' situation. They had no idea. The pediatrician that I initially had when I was a baby was, to put it in terms, a quack. He basically blew off a lot of stuff that my parents had brought up to him as them being new parents, because I am the oldest in my family. But because I had caused a lot of stress with my mom, because I had apparently cried a lot and screamed a lot throughout my first 6 months of being a baby, she was at work, got stressed out. One of the ladies asked her what was going on. She told them that, you know, I had been screaming and crying. The pediatrician wasn't doing anything to help the situation. He wasn't looking at me. He wasn't helping my parents understand the situation of what was going on with me. And the lady that my mom had spoke to had actually said, oh, well, let's try, you know, you can try the pediatrician I have, he's amazing. So my mom had changed me over to this other pediatrician. Come to find out, not only did I have dual ear infections, which is why I'm also hard of hearing now, because I have those chronically, and I still do to this day, but the pediatrician that they had transferred me to found out that I had a dislocated hip. But the situation at that time, he could not fix it because I was 6 months old, and it would have caused a lot of harm to my joints if he had attempted to fix it then. So he said that either it would pop into socket when I started walking, or I'd have to have surgery after that. And it went into the socket, but obviously, as you see now, I have hip dysplasia. So you can have hip dysplasia as a baby, you can have it as, you can basically have it at any point in your life. Most commonly, infants will have it, older people will have it. My grandparents both had it on both sides, and I have it. And I'm not an old person. I'm about to become 30 years old. I've literally had congenital bilateral hip dysplasia pretty much my entire life. And we're hoping that since I've had these hip surgeries that it's going to be good to go, at least for another 20 years or so. And then we'll see from there. So, okay, so, question 3. How do you know you have hip dysplasia? Well, to put it into terms, you won't really know until you go to a doctor, but your signs typically are popping in the joints, weakness in your hip joints as well. You might just have constant hip pain, and you don't necessarily want to take this lightly because in the long run you might have joint slippage, which can cause a dislocated joint basically. You don't really want to take those signs and symptoms lightly. You want to go, if you can't go to an orthopedist because they need a referral, you will want to go to your family physician so that they can give you that referral to go to the orthopedic. And you really want to get that done as soon as you start having like these pains, and like, I wouldn't say go immediately if you have signs of pain. I would say most commonly the weakness in the joints, the popping, is a big concern. So once you go to the doctor, you get that referral, go to the orthopedic surgeon, because they're all basically surgeons. You don't really have just an orthopedic doctor. I went to my orthopedic doctor who referred me later on because I had gone to the orthopedist previously for wrist issues, and then I ended up going to him, telling him what's wrong with my hips, and he referred me to a surgeon who then did the proper tests and the x-rays that I needed to have the diagnosis. Typically, they can diagnose you with hip dysplasia via an x-ray. If not that, then you would have to go further on to CTs and MRIs. For me personally, I've had these pains since I was a child. I went in high school to an orthopedist, a pediatric orthopedist, who back in those days didn't really have the knowledge of hip dysplasia in a child, and they didn't really have the proper tests to understand the concept. So seeing an x-ray for him, he said that these were just growing pains. They sent me through the x-rays, they sent me through MRIs, CT scans with contrast, they sent me through bone scans where you have to have an iodine injected into you. Then you have to wait a little bit, and then you have to go have these scans done to see where the contrast might light up, either for like stress fractures, breaks, or dysplasia, or any tears anywhere. And all those tests came out clear. So they sent me as referred for physical therapy, and at that time I felt like, and I spoke to my family obviously because I was still in high school. I spoke to them and I said, you know, I'm in track and field. I don't see why this would be something that would help me at this time. I might as well just start running again, because I was on what I would personally call the cripples list, where you were injured, they would put you on this list, you would have to go through all these trials, and the doctors would have to release you to be able to run again. Well, since they were going through physical therapy, they let me run again, and later on, I actually did do physical therapy. They stretched out my muscles, they put me through shock, which isn't as bad as it sounds. They actually just put these little electrodes on your muscles, and they give you a little bit of electrocution to kind of move those muscles around, tense them up, and then let them loosen and everything. And that worked for a little while, but then the pain came back, so I ended up going, obviously, to my orthopedist that I've had for my wrists, and he referred me over to my surgeon who diagnosed me with dysplasia. So that is the common way you would want to go. You would want to go to your doctor, who would refer you, and then they would do the orthopedist would do the tests. So that's how you can find out if you have hip dysplasia. Okay, question 4. What is the difference between a PAO and a hip replacement? Now, I get this question a lot, actually. A lot of people think that we go through hip replacements, that everybody with hip dysplasia goes through hip replacements. And that is completely not the case anymore. Not these days. Back in the day when hip replacements were very common for hip dysplasia, maybe, but not today. So, what is the difference between a PAO and a hip surgery? A PAO, and in a PAO, this is going to sound very graphic. I know a lot of people that I've had to explain this to get very like, and they think it's really, really gross to hear about this. So if you have that, please either mute this part or skip a couple seconds, because this is about to sound kind of somewhat graphic, as some people think. A PAO is when they take your pelvis, they break part of it, they realign the joint, and then they screw it back together. A hip replacement, they take that entire socket and ball joint and they take them out, they screw in a new ball joint to your femur, and then they replace your socket joint, and then they put them back together, and then they sew you back up. A PAO, they break your pelvis, screw you back together, and then they sew you back up. Here's a couple photos of what a PAO would look like in a drawing. Let's see, right here you have your hip dysplasia. This is when they cut a piece of your pelvis out. This is when they cut your pelvis out. This is when they screw you back together. And then this is what you would look like healed up, but they don't show that you still have your screws in. And that's what it looks like. So, actually, you would have screws in your hip that they don't really show here, but they don't typically bother you. If they do bother you, then they remove them, but usually the doctors will want to leave the screws in, because if they're not bothering you, what's the point in taking them out? So I actually have 5 screws in my right hip, and they did remove the screws out of my left hip because they were bothering me. So I don't really have those in, but I do still have my 5 screws in my right joint. So that's the difference between a PAO and a hip replacement. Question 5. What is the beginning process for a PAO? Alright, well, the first beginning process for my journey for a PAO was, of course, talking to my doctor and getting the diagnosis, which we did through an x-ray. He said that I had it. I actually ended up, excuse me, goodness. I ended up getting a second opinion on his diagnosis just to make sure. You know, you don't want to exactly go through a very invasive procedure if you don't have to, and you really want to get a second opinion just in case that might be the case. So I did that. After that, he gave me a couple prescriptions, I would say, or referrals. One was for physical therapy, because the process for insurance is you get the diagnosis and then they want you to go through physical therapy to see if that helps the situation. That's not always the case, and obviously us hip dysplasia people, we know this. So we go through physical therapy knowing that it's not going to always make us better. It might help a little bit with the pain, but it doesn't always help with everything that's going on. So you go through physical therapy. That doesn't always work. You go through the cortisone shots. They actually go in with an x-ray, and they go in with like a little IV thing, and they go into your joint and they inject you with cortisone. that might not always work. And it might a little bit for a little while, but it doesn't work always in the long run. So we go through the cortisone shots and the physical therapy. Then we have MRIs and 3D CT scans, which we get to make sure that we don't need labrum stitching. The labrum is in between the socket and the ball joint. It's that little cushion in there. And if it's torn, they have to go in and stitch it. So they do the MRIs and the CT scans to see how much they have to do when they do the surgery. And then after all of that is done, then we go through the pre-op. We go through the pre-op appointment. And then what goes on there is up here they will give you a lovely little packet up here. And when you go in there, you'll actually go into up here. We go to the surgeon, we talk to them about the procedure and everything that needs to be done. We sit there, we go through the counseling with them. We find out what has to happen during the procedure. We have to know that they have to cut us open. They're going to do a laparoscopic surgery also just in case, to see if they do need to stitch the labrum. They will tell you what has to go on in the procedure, which is in this packet, which actually helps a lot. This is the hip preservation program. So we get this packet, and then we go over for our stuff up here in Ohio. We have to go over to the hospital, and there's actually only very few doctors in the United States and even in the world that do this kind of surgery. So it's very difficult to find somebody that will do the surgery. If you're in like a different state, say Philadelphia, they might have a surgeon there. You might even have to travel to Ohio or New York to get it done, or even to Massachusetts, or you might even have to go to a children's hospital to get it done because it's such a hard procedure on the body. But in the long run, it's good to have, because you preserve your hip joints. You don't have to go through the replacement process twice, and you can only get it done, the replacement process done twice in your lifetime. So being in your 20s or your teens even, or even in your 30s, they don't want to always do the replacement process if they don't have to. So they will do the PAO surgery. So we get this lovely little packet, and in it, at the hospital, it has all this lovely stuff that you have to do before your surgery. They tell you how to bathe the night before and the morning before your surgery. They will give you a soap that you have to use that helps kind of keep infection and bacteria down, and you have to wash twice with it. You have to wash it the night before and then the morning of with it. And then they draw your blood, obviously, so they can run a bunch of tests. Like, they actually check for tobacco use because they tell you to stop smoking, chewing, or whatever you do tobacco-wise. They don't want you to do anything, so they check that. They check your blood levels, they check your glucose, they check your iron levels, they check all these other crazy things before your surgery so that they know what they need to do in the long run. And that is basically what the pre-op process is, and they usually do that about a couple weeks before surgery. So that is what happens with the PAO. Question 6. The day or morning of surgery. So that morning or that day, typically it's the morning, they will have you obviously take a shower before you come in. And you have to use the special soap to keep bacteria and germs down. And then you come in wearing comfortable clothes, because you don't want to wear anything like extravagant, or you don't want to wear belts and shoes that tie, because you're not going to be wearing them for a few days at least. So the morning of, you will go in. We went into the hospital. We went to the front desk. They told us how to get up to pre-surgery. So we go up to pre-surgery and we check in with the front desk there. And then a nurse comes out. They check my name and date of birth and all my information. Then they take us back to a room where I have to change into, I always wore sweatpants and a t-shirt and no bra, obviously, because I'm not going to wear a bra for a few days. What does it matter anyways? It's like 6 o'clock in the morning when I get in there. So, change into the gown and the socks, and I put on the little mesh cap thingy that they give you, and I take off all my jewelry, and then they come in with, this is the funny part, I thought it was personally funny because I've always heard about Oxycontin, always heard of it, never had it in my life. They come in with 2 pills and go, the doctor ordered you to have Oxycontin for the morning before your surgery. So I'm like, okay, Oxycontin. Never had Oxycontin in my life. I have no idea what it's like. I don't know what's gonna happen. I mean, I've had a lot of painkillers in my life because of my endometriosis and hip dysplasia. So I've always had, you know, I've had a variety of pain medication previously. Oxycontin's a little bit different. After, I'd say about an hour or so, I have no idea what's going on around me. I just kind of agree with the nurses and doctors, which is why you always have to have an advocate with you that morning. So you take the medication that they give you, and then they'll give you an epidural. They will actually, in the hospital, for pretty much every surgery I've ever heard of any of the hip dysplasia world, they will give you an epidural in your back. And it's usually very, very tiny, which kind of surprised me in the beginning because, as you know from some of my other vlog videos, I have a child. And the epidural for having a child is it feels like it's really big compared to a hip surgery epidural. The hip surgery epidural feels like a little tiny needle and that's it. And sometimes, depending on what the doctor wants you to have, they'll give you epidural with pain medication or they will give you an epidural without, depending on the situation. First time I had epidural with pain medication, I legitimately do not remember from the time I had it into about 4 weeks after surgery. This time I remembered pretty much everything. I say pretty much because you're obviously going to be tired for quite a few weeks. So the morning of, they'll give you all that, they'll relax you, they'll take you into the surgery room, tell you what all is going to happen, and then they'll put you out. They'll give you like a gas mask and then an IV and you're done for the day, literally. So that's basically what happens during the morning of hip surgery. And next question we go to. Now, question 7. What do they do during surgery? Well, during surgery, and I'm going to explain this the best I can. Well, we already went through the process of a PAO where they cut a piece of your pelvis, they realign it, and then they screw it back together after giving the proper angle for a corrected hip. And then they screw it back together. Before that, what they will do is they will put you under a deep sleep. They'll make sure that you're not in pain and that you're comfortable. They will intubate you, which means that they're going to put a tube down your throat to help you breathe because they're going to put you under a very deep sleep. You will not wake up during this process. I know for a lot of people, and I've actually gotten a question about this, and I'm going to actually locate the questions. Some of the questions I'm going to put down below, and you're going to see them linked, or you're going to actually see a screenshot down below of some of the questions I'm about to go through, because I also have a few other questions from other people that have either gone through the surgery or going to go through the surgery. That's from the feedback that I've gotten for this Q&A idea. So they will put you into a deep sleep and you will not wake up from with the intubation tube in. They're going to help you breathe during the process. They're going to scope you to make sure that your labrum is not torn, or if it is, they will stitch it back up. And then they will stitch those little laparoscopic holes back together, and they will stitch your hip. Well, they won't really. Sometimes they might stitch it, sometimes they will staple it, or they will glue it shut depending on if you have specific allergies. And then they will bandage you up really well. They'll make sure that you're very comfortable. They'll remove the tube as they see fit before you wake up to make sure that you're breathing properly. And they will cover you in warm blankets with pillows and everything on the bed, and then they will send you over to recovery. And that's where you're gonna wake up. Your throat might feel sore, you are gonna feel very groggy, you might not remember much, you might be in pain. You make sure to tell the nurses that. They'll give you the proper pain medications to handle that. After the surgery process is done, they'll take you up to a room, and then there you're going to stay for a few days. And during that process, they're going to help manage your pain with the proper medications. They'll help bring you back into a normal diet, depending on how your body accepts food and drink. And from there, they will make sure that you're comfortable, that you can eat. They'll send a physical therapist up. They will make sure that you can walk. Within like a day or two, they might remove the epidural out of your back. You'll have a drain tube in your leg to make sure that that does not get fluid in it. They'll remove that as they see fit. And then they will start you on a process of becoming ambulatory with your hip. With my surgeon personally, they did not let us weight bear, which is putting weight on your foot, on your hip, for 6 weeks. So they teach you how to get around with that. And I will go through a few things that I had for my surgery and for post-op that helped me a lot. And we will go through a few things of those that I had the first time I had surgery and then this surgery. And I will explain those as we go. And we'll go from there. Okay, now that I've gone through my entire list of what I have to put in this Q&A of common questions that I get, or common questions that anybody in the hip dysplasia world gets. So now we're going to go through some of the questions that I've actually gotten on some of the feedback that we have. So let's go through those. This is the first one I actually got. I'm getting this surgery June 17th. I'm really nervous because it's my first major surgery. Did you wake up with the breathing tube in as well? Because that is one of my fears. This is a question I actually just answered. No, they put you in a very deep sleep so that you don't wake up with this tube in your throat. I know it's a very scary thought to have, but I'm pretty sure that you'll be okay. Or actually, since they just had the surgery on the 17th of June, pretty sure that they were okay. They went through the process. I'm pretty sure they didn't wake up with the tube in their throat. I did not get that thought.
Actually, you did the first time.
I did?
Yes. When they take you into the recovery room, you still had the tube in your throat. They actually were there. You don't have to turn it around. Yeah. Okay. But anyway, you were out. When you woke up, you still had it in there. You were really groggy and drugged up the first time. The second time, they wouldn't even let me back there, so I have no idea if that's. I'm pretty sure it'd be the same thing. But you were still like incubated, I guess.
Intubated.
Whatever. You had 2 babies in you the first time, which was really, really horrible for you because you woke up, you didn't really know you had it, and the only time you actually felt anything was when they were taking it out. So, but yeah, you actually did have a tube.
Well,
and it seems like you done messed everything up because
I always mess it all up. Well, apparently I didn't know that. But the second time, I'm pretty sure I did not wake up with it in my throat. If you do wake up with it in your throat, you probably won't remember it because Obviously, you see, I did not remember that part. So,
you
that
also don't remember demanding me to go buy a whole thing of Wendy's.
Now he's trying to make me sound bad. Alright, so that was one of the first questions I had. The second one, I have bilateral hip dysplasia and I'm researching about the surgery and recovery time. I was wondering what you can tell me about your experience apart from the videos. What was the hardest part, the scariest part? When did you start feeling better? When can you start walking normally? What was the easiest part? Okay, well, let's start with what was the hardest part? Well, being the fact that I used to be an EMT, I was an EMT for 8 years before I had this surgery. I went through constant pain every day for those 8+ years with this hip dysplasia. Yes, it was hard, but I was a very active person regardless. I always had to be up and doing something. I was always making myself busy. The hardest part was the 6 weeks of recovery where you can't do anything. You can't do squat. You can be up on crutches, which I'm going to show you about later on, but majority of the time you're going to be laying down or sitting down. And that drove me absolutely crazy because I wanted to be up, I wanted to be out, I wanted to be going places and doing things that I couldn't do at the time. So the hardest part, I would say, was sitting on my butt, not doing anything. What was the scariest part? The scariest part, I actually lost my balance one day trying to go down a small flight of stairs to get to our in-ground apartment at the time. And I put weight on my hip. I lost my crutches and I put weight on my hip, which is not, you don't really want to do that if you're in a non-weight bearing situation, but it's not the end of the world. You don't want to do it, but in emergency situations where you're gonna fall down a flight of steps face first, it's okay for a little bit of weight, but don't do it if you don't have to. The scariest part was doing that. And then the other scariest part was more current when I had my last hip surgery. I was down on the floor because we had moved the mattress into the living room because it was just easier for me for some reason or another to sleep on the couch. So Devin, my husband, was sleeping on the mattress in the living room next to me because he didn't want to be in the room alone. So I laid down on the mattress. After 4 weeks, the physical therapist said that it was okay for me to lay on my stomach. And he encouraged me to do it because it was part of the healing process. So I was down on the mattress doing that. And I went to get up, and for some unintelligent reason, I decided to put my right hip down, or my right knee down, which was the hip that I had just had surgery on. And I heard a big popping sound, just a pop. And I was like, oh, I just snapped every single muscle in my thigh joint. I just screwed everything up that I did. This is gonna be really bad. I'm gonna feel all this pain I've been trying to keep away from me for the longest time. I was terrified of this part. Well, lo and behold, that was not the worst pain that I had. I actually pulled muscles in my left hip and in my left leg, which was the side that I had the screws removed on at the same time that I had my right PAO. Which, to be completely honest, I don't recommend having a screw removal at the same time that you're having another PAO. Because you have to rely on the screw removal hip to get you around, and it can cause a lot of muscle problems, it can cause a lot of just pain and issues and stuff like that you have to work through. So it's very difficult to kind of get through that part. So I recommend getting a PAO and then getting the screws removed and not the other way around. Okay. When did you start feeling better? Depending on which surgery we're talking about, I started feeling better maybe, I'd say about 3 months out on both sides, because the first time when I had my left hip done, I had physical therapy. I actually had to go in every other day, 2 to 3 days a week, to do physical therapy with a physical therapist that actually specialized in hip surgeries. Sorry, there was a little gnat that flew past. And she would actually do everything with me. She'd add on new exercises and everything that would actually help with my strength and endurance and my balance, actually. Because I've always had terrible balance. I still do, but that kind of helped a little bit with my balance issues, was to actually do stuff with my physical therapist. The second time I did not have a physical therapist. Well, I did, but I would only see them every few weeks to get new exercises, and then they wanted me to exercise at home and not at a facility with all the right equipment that they had. And I would get different belts, like little rubber band belts that they would give me that had different strengths to them to use at home. So I would feel better about 3 months or so out, a little bit, depending on the situation. When can you start walking normally? Like I said, I would say about 3 weeks out, because you're on crutches for about 6 weeks. And those 6 weeks you're not doing anything with that hip whatsoever. You're gonna see atrophy, which means the muscle and fat in your leg is gonna go down. And you're gonna see that leg look smaller and smaller than the other leg. So you're gonna actually have one leg skinnier than the other, which is gonna look weird at first, but you're gonna have more of an understanding of what extremes you go through for the healing process for that leg. So about 3.5 months out is when you usually start walking more normally. You'll start with 2 crutches. You'll dwindle down to 1 crutch, depending on either your physical therapist or your doctor says otherwise. And then from the 1 crutch, you're gonna go to a cane. And with me, the cane was the longest part, I felt, because you're gonna be on that cane for a little while. You gotta figure out your balance and how much weight you can put on that leg at certain amounts of time to get yourself back to a normal walking. And it's gonna feel weird because obviously you haven't had that hip joint corrected in so long that it's gonna feel funny at first to walk with all your weight. So you're gonna feel like you're limping, and that's why they keep you on 1 crutch for a while and then they put you to a cane. They don't just straight up take you off your crutch usually. So that was the longest part. That was when I started walking normally, more or less, was with a cane. I had it a little longer than I thought than some people might, because I wanted to make sure that I wasn't going to start limping without it. And then, what was the easiest part? The hardest part and the easiest part are basically, I would say basically the same thing, was doing nothing for 6 weeks. You can't walk, you gotta sit down, you gotta lay down. You know, you might feel like that's the life. You don't have to do anything, you don't have to get up except for going to the bathroom or getting something to eat. You just get to sit and watch television. And that seems like it's an easy thing unless you're a very active person. So the easiest thing is also the hardest thing, is not walking and not doing anything for 6 weeks. So those are basically the same answers, I would say. Let's see here, the next part. Post-op pain management challenges. My challenge was post-op pain management. It was a very difficult process because a lot of doctors are afraid to give you pain medications. They're afraid that you're going to get addicted to them if you take them for a long period of time. And I'd say that that's a bit concerning, yes, because, you know, I was an EMT for 8 years. I've seen what it's like to be addicted to pain medication. But if you're obviously, because those doctors intentionally, to fix the situation, they intentionally put you in a lot of pain, so obviously you're going to want to have pain management. but they can be very stingy at prescribing medications. I'm not saying that's a bad thing, but it is a very complex situation because you'll be in a lot of pain and they don't really want to give you anything after a certain amount of time because they don't want you to get addicted to it, but you're in a lot of pain at the same time. And it's a big conflict between, you're obviously in a lot of pain, they know you're in a lot of pain, but they don't want you to have these pain medications. So that's kind of the battle right there, is pain management is a big challenge. And for me, because I do honestly have a high tolerance for pain medications because of my endometriosis, I can't be on Percocet or Vicodin. I have to be on Dilaudid, which is a lot stronger of a medication, because I have the tolerance against Percocet and Vicodin after didn't take it for a long time, but I took it off and on for a long time. I was off and on it for a long time. And now with Dilaudid, I was going off and on it for those 4 to 6 weeks with the first surgery, and then 4 to 6 weeks with this surgery. And it can be a very complicated situation trying to get it correct to help keep you in the proper pain management. And you want to take those pain medications along with all your other medications that you do have to take on a specific schedule to make sure that you're not necessarily overlapping them. You want to take them at certain specific times, like every 4 hours have an alarm set, or every 6 hours have an alarm set, or however they want you prescribed it. And not only that, with those medications, I was also taking calcium pills. These pills are huge. And I was taking them once to twice a day. Let me show you what they look like. They are ginormous. These are cow pills. Or horse pills. Horse pills. Huge. And you do want to take calcium pills at least once a day, every day, after surgery, to help with bone strength, to make sure that you get the proper amount of calcium in your diet, regardless if you're drinking milk or not. You want to make sure that you get the right amount, a lot of calcium to help with the bone density and bone strength. After surgery, your bones are going to feel really brittle and weak, so you want to have that calcium. You're also going to want to take iron, which is, for me, iron kind of makes me feel nauseous and sick if I take it. So you want to be really careful with that. But you do want to take iron because your blood levels are going to go down. Your iron levels are going to go down because you're going to lose blood during surgery. So typically they will have you do a transfusion of your own blood. They're going to make you auto-donate blood twice at least for each surgery, because you're going to lose blood during surgery, so they're going to transfuse you back with your own blood. Sorry, they're playing fireworks outside. And then for the bruises and everything else, I highly suggest going to this lovely place from, bruises from IVs and stuff. You really want to, and dry skin, I highly suggest the oil bar. I got this awesome stuff, which is called the Skin Healing Essentials, and it has cocoa butter, it has, what was it, lavender? Was it lavender? I think it was lavender. And I asked them if they could put mint in it, because that's my favorite smell, and they did. And this stuff helped me so much with my bruises. It was amazing. So that's stuff that you really want after surgery to help with the healing process. Okay, next question. Did you have a brace for the hip at all? The first time I did not have a brace. They just basically did the surgery and had me go home with some crutches. This round, during pre-op, and you'll see that in the first vlog journey that I had, they gave me, I don't know if you can see it, this hip brace. They gave me that hip brace. They fitted me for it and everything. And I used that as they had prescribed in that during that video, and you'll see that. So yes, I did have a hip brace. Also, I will retouch on this question. I was given a epidural during my surgery. I was asked, were you given an epidural for your PAO? Because I had a few questions about that. And the questions were, I just feel really numb just in the hip area even after 24 hours from the epidural. I feel no pain at all and don't know if that's normal. Not sure if maybe you experience the same thing. You will have that because during the surgery they're going to either cut or damage some nerves in your hip joint. And the epidural does help with the pain usually. Sometimes it numbs everything else around it, and usually the hip might follow, the hip might not. First time my hip did not feel numb. I did feel the pain, but I felt nothing else around the area and I couldn't move my leg. The second time I didn't feel a thing and I still couldn't move my leg with the epidural in. So you might not feel anything, you might still feel numb afterwards because those nerves are going to be damaged. And as they repair, you're going to feel like your hip is on fire. You might feel like overly sensitive with pain, like anything that touches it might hurt. And that's basically just because the nerves are reconstructing themselves. Now I'm going to go through really quick some of the stuff that I had from my recovery and everything else that had to go through my hip surgery. Okay, now I'm going to be showing you guys some of the stuff that I still have from my hip surgeries that helped a lot with the recovery process. So this is a grabber. It was super awesome to pinch people's butts with, and you'll hear that a lot from some of the hip dysplasia people. A lot of them were like pinch, 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 pinch. But it actually did help a lot with, like, if you're standing and you accidentally drop something on the floor, you know, you reach down with it and grab. So a grabber is always good to have. You never know when you're gonna need it. The next thing, I woke up with this lovely machine. You're gonna have to pan down for this one. This is the Iceman Classic. This thing, I loved this machine. It actually helped a lot. And it is an ice machine. You put ice and water in here, and then you close it and lock it up, turn it on. Well, you plug it in to turn it on, and then you have this little dial here that you can make it not so cold all the way to the coldest. And the first pad I had actually had like soft Velcro on the top of it, but that kind of fell apart really bad. So actually the company that has this is I think it's Dawn Joy or DJO. They sent me a replacement pad, and I love that they did that. It was really helpful that they did that. I highly recommend them. And they also had, like with this ice machine, you have this band that goes around you and you can Velcro it onto you to kind of help keep it from like shifting around and moving as you lay there, or if you like turn or anything, the pad will go with you. Next thing, I highly, highly recommend having a set of these. These are Moby legs. They are crutches. These things are very helpful when you walk, when you have to have them to get around. They're not just crutches. At the top of them, you'll see these kind of move with you. So when you're crutching around, they kind of help keep from like irritating under your armpits. These things are very cushiony, and they have a right and a left to show you how to use them. So they would actually go like this, and mine bow in, but typically some people have them straight out like this. But I had mine bow in because of my balance issues, so I actually had mine in like this, and that's how I got around. Last thing I recommend having is, you don't have to have this specific cane, but I have this type of cane. I have a purple one because purple is my favorite color. This cane helps get around. It has very good balance. It's not like a straight cane or a straight up and then curved cane. And it's very comfortable to use. So I always recommend having a cane for when you start walking without crutches. Now, just to let you guys know again, everybody's different. Every person's degree of dysplasia is different. And every surgeon is going to be different. So what I show and tell you guys here might be different with a different orthopedic surgeon. So don't always go off of what I have to say. And if he is, then this will be a very good video for you. But don't always go off of what I say. This is just what I had to go through. These are the answers to the questions that I have. These are my answers for those questions. And that's the papers from the surgery that I had. So, just to let you guys know that everybody and every doctor may be different. And I will see you guys later.
Exactly.
My Little Pony.
Miss Sparkles a lot.
Miss Sparkles.
She's all serious over there with her Q&A. See, look at that. She was like, if I want to put more lip gloss on. She's trying to blind everybody.
I'm not trying to blind everybody. I'm trying to look good because in YouTube world, you want to look good for your videos.
Good.
You want to look good for your videos.
I'll tell you what, you are so shiny right now. And so bright. If you put anything else on you, you're gonna be like my bald head. Nobody's gonna help you from me.
You have no idea what I just said to her here. I was trying to sign her name. I think this was her name sign. I don't know if this is still her name, so I'm pretty sure it is.
Well.
So.
Anyway.
Okay. Question 7. What did it do during surgery? The morning
I feel
of...
like you forgot question 6.
I probably did.